5 signs on your body that your heart may not be healthy. If your heart could talk, would it be asking for help right now? The truth is, many times it does speak, but not with words. Instead, it sends warning signs through your body. The problem is that most people do not recognize these signs, and the result is alarming. According to the World Health Organization, cardiovascular disease remains the leading cause of death worldwide, claiming more than 17 million lives every year. But there is good news. Your body is smart and often warns you before a tragedy happens. Today, I am going to show you 5 visible signs on your body that may indicate your heart is not working as it should. Stay until the end, because the last sign is often ignored and has already saved many lives when detected in time. Sign 1. Frank's sign. Look closely at your ears. Have you ever noticed a diagonal crease cutting across the earlobe, almost like a small wrinkle? This is known as Frank's sign, first described in 1973 by American physician Dr. Sanders Frank. At the time, he noticed that many patients with chest pain and blocked arteries had this exact mark. Since then, several studies have confirmed this observation. One study published in the New England Journal of Medicine found that people with this crease were significantly more likely to have atherosclerosis, the buildup of plaque in the arteries. It is not an absolute rule. About 30% of people with this crease have no heart problems, but if it appears in someone young, before the age of 50, the warning should be taken seriously. Quick story. A friend of mine, a runner and seemingly healthy, went for a checkup only because his wife noticed this little crease on his ear. The test revealed severe coronary artery blockage, and he was able to treat it before having a heart attack. Sign 2. Loss of hair on the legs. Have you noticed that the hair on your legs is thinning or disappearing? It might seem like just an aesthetic change, but in medicine, it can be a sign of poor circulation. Hair follicles need oxygen-rich blood to function. When the arteries in the legs start to narrow, the skin receives less nourishment and the hair falls out. Along with this, the skin may become smoother, colder to the touch, and even change color. The American Heart Association warns that peripheral artery disease, which causes this type of change, is a strong indicator of risk for problems in the heart's arteries as well. Think of your arteries as roads. If there is a traffic jam in one area, there is a good chance there are blockages in other areas too. Sign 3. Xanthelasma. Have you noticed small yellowish patches near the eyelids, usually close to the inner corner of the eyes? They are called xanthelasmas and are deposits of fat under the skin. Half of the people with xanthelasma have high cholesterol or elevated triglycerides. What few people know is that Danish researchers followed more than 12,000 people for over 30 years and discovered that those with xanthelasma had a higher risk of heart attack, even with normal cholesterol levels in blood tests. Sometimes your body shows on your face what blood work has not yet revealed. Sign 4. Arcus senilis. Look in the mirror. If you notice a whitish or grayish ring around the edge of your cornea, it might be arcus senilis. In older adults, it is common and usually harmless, but if it appears before the age of 45, it may be a sign of very high cholesterol and triglyceride levels. This means the fat is not only in your eyes, it is circulating in your blood and may be building up in your heart's arteries. There is a famous case reported by ophthalmologists in the US. A 38-year-old patient was referred to a cardiologist simply because an optometrist noticed arcus senilis. The diagnosis? Advanced atherosclerosis. He began treatment immediately and avoided serious complications. Sign 5. Swelling in the legs and ankles. At the end of the day, do your shoes feel tighter? When you press the skin around your ankle, does it leave a deep mark that takes a while to disappear? This swelling, called edema, can be caused by a heart that is not pumping blood efficiently, leading to fluid buildup in the tissues. Cardiologist Dr. Clyde Yancey from the American Heart Association explains that this is one of the most underestimated signs of heart failure. Many people spend months thinking it is water retention or tiredness until the situation worsens. If swelling is accompanied by shortness of breath, fatigue, or rapid weight gain, seek medical attention immediately. Conclusion and prevention. Your body is like a silent alarm. These signs do not appear for no reason. Recognizing them early can be the difference between living a healthy life or facing a cardiac emergency. So watch your body closely, get regular checkups, and take good care of your heart. As Dr. Paul Dudley White, one of the pioneers of preventive cardiology, once said, "Time and health are two precious assets that we do not recognize and appreciate until they have been depleted." If you want to live longer and healthier, keep watching the videos here on the channel. Each new video brings valuable information to help you prevent disease, strengthen your body, and enjoy a better quality of life. Do not stop here. Watch the next video and take another step toward protecting your future.